Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Hello everyone, I am Dr. Nikhil Nawale. I am practicing as consultant neurologist in Solapur, Maharashtra. I have been working in epilepsy, stroke, movement disorders, and other neurological illnesses.
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, seizure actually it is some abnormal extra electrical activity in the neurons, which are the cells in the brain. So they fire uh, uh, at an uncontrolled rate, which causes different parts of the brain to overreact. So that is a seizure.
What is epilepsy?
uh, a patient who gets more than two episodes of seizure, or the patient in whom the risk of having a second seizure after the first seizure is more than 60%, we term them as epileptics, or like it's called as epilepsy.
What are the different types of seizures and do they affect people differently?
Yeah, actually, the type of seizures depend upon the what part, means whether the seizure starts from one part of the brain, or it starts from the end, whole brain. So on depends on that type, it is divided like focal epilepsy or focal seizures or generalized seizures. In generalized seizures, the seizures start from the entire brain, so the brain gets electrical activity. The entire brain becomes electrically active, and it fires. So it's called a generalized seizure, or and only if a part of brain overacts or it overstimulates, then it causes a focal seizure.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
Actually, nearly half of the patients of epilepsy we get some or other cause, and remaining half we don't find any what we call any cause of that epilepsy. So the most common cause what we usually see is some brain infections, then some diseases in which the blood supply to the brain is affected, and where the stroke develops, and from that part becomes overactive, and then it triggers seizures. Then there are if in previous in cases where there is an head injury, there is a trauma to the brain, so the part of the brain gets degenerates, and a scar is formed over it, and this can also trigger a seizure. Then there are few diseases, like there are few genetic conditions in which there are inherited causes, which in which the brain has some chemical imbalance, or some the metabolism of brain is affected. Then that patients can also get seizures. So it depend. There are various causes of seizures, but like in 50% of the patient, we didn't get any obvious cause of the epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
Okay. The most common type of seizures, what we generally the people get scared of, or what most of the people get, is the shaking, the rhythmic or non-rhythmic shaking of the body. It is associated with uprolling of eyes. Then there is frothing at the mouth. Then there is a tongue bite. The whole in few seizures, the whole body gets tightened, and patient loses his consciousness. He falls down and sustains injury. However, there are few types of seizures in which patient will not shake, or will not become unconscious. The patient gets confused. He do some abnormal movement, like lip smacking, like some sounds. In some seizures, patient starts laughing. Uncontrollable laughter is there. So these are different parts of this different types of seizures. It depends upon what part of the brain gets active.
Now, let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Unfortunately, the person suffering from epilepsy uh, are faced with a stigma that it is uh, if if somebody witnesses a seizure, he gets very frightened to see what happens, because the jerky movements and the uprolling of eyes, the people around them are shocked, and so they become very conscious about that patient. They start treating him differently, so they don't go to regular schools, or like in schools also the teachers are skeptical to adjust with the students. Then there is problem in the in a lady uh, or a guy who wants to get married, because there is a social stigma that it passes in families, so it is inherited. Not all causes of epilepsy are inherited, and like the people with a person suffering from epilepsy don't conceive. These are all misconceptions or stigma in the society. So this is what we have faced in last 5 6 years of our practice.
How does this stigma affect people with epilepsy?
Uh, so the person suffering from epilepsy try never most of the time they are not very socially active, or like they miss from the mainstream of their education or mainstream of the public activities. So they miss on the employment opportunities. Like there have been cases that the employers don't want their employees to have employees who are suffering from epilepsy. So these are the day to day problems they are facing.
Absolutely. Now, let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay. Common triggers are: first is missing medicines. Second is if the patient misses his meals, or they have inadequate sleep, so or they are exposed to loud sounds or flashes of lights which stimulates the brain. So any or if any illness he is suffering from, any febrile illness, or he gets ill due to some other disease, these are the most common triggers we face in our day-to-day practice.
That's a great tip, doctor. What other lifestyle adjustments can help someone manage epilepsy?
So lifestyle adjustments are just avoidance of the triggers. Like the people should have the balanced diet. They should not skip their meals. They should have peaceful sleep at the night. They should not stress themselves physically or mentally. Then they should exercise. They should have a balanced diet, so to avoid the adverse effect of the medicines, and also to not because most few drugs cause weight gain. Just to avoid that, they have to exercise daily, meditate to decrease the stress levels, and etc etc.
Thank you so much, doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. So the most what we generally advise to the relatives or the people accompanying the person with seizure, don't get frightened. First, take them to a safe environment. Avoid any sharps or avoid any fire around the patient. Loosen the patient's cloth. Clear any obstacles from his nose or from his airway. Don't indulge in putting some metals or some sharp things in the mouth, just to get rid of the clenching of teeth. Avoid handling. Then just make the patient lie on a lateral on one side. So call for medical help. See whether there is any riskful environment in his surroundings, and clear the surroundings, and call the emergency medical services as early as possible.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
So people with epilepsy or the relatives of people suffering from epilepsy don't get stigmatized. Like epilepsy is not an untreatable like not any dreadful disease. If treated properly, if treated under proper medical or neurological guidance, the patients get cured of it, and they lead a normal life like other people surrounding them.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.